Our next speaker is already on the way up here. It's Mia Heck. She is the director of the HHS Task Force for ALEC, and that's the American Legislative Exchange Council. Many of you know, in this room know her. Many people have worked with her, and she has some interesting points about this to share with us. So, Mia, thank you for being here.
Thank you, Dr. Schurz, for hosting this very important program. I'm pleased to be here. I'm the Health and Human Services Task Force Director at the American Legislative Exchange Council. And for those who aren't familiar, at ALEC, we create model policy. We have 9 task forces, tax, education, HHS, et cetera. And we come together 3 times a year with our members who are legislators, state legislators, and private sector members to talk about public policy and reforms in public policy that will save money, reduce costs, increase quality, et cetera. So in preparing for this program, I reached out to some members of the task force who I know work in the Certificate of Need area. And one in particular serves on the board, the Certificate of Need board for the state of Illinois. And she shared some of her experiences working in that capacity. One of which, and I don't want to be repetitive of some of the things that had been brought up in earlier presentations, but one of which that I thought was very interesting, that in addition to the powerful hospital lobby, when you are coming up against opposition or you're trying to spearhead a campaign in opposition of con laws, you're also going to be fighting a significant part of the legal industry. These are attorneys and consultants who have built careers and have longstanding relationships in trying to repeal these laws. They go take the board members of the Certificate of Need entity in that state to lunch. They have very friendly relationships outside. They are experts in getting them to yes. They know exactly how to fill out the application to where it will be most effective, and they're a formidable opposition that you will also want to keep in mind if you're going to endeavor down this path. Also, these boards, I know you're aware, but just to be reminded of their immense power, is that they can make or break communities based on the approval or denial of an application. And that is through the availability of jobs, investment in infrastructure, operations, which is completely outside the question of access to care and improving quality of care in a community. Also, many hospitals, as they cite the need for con laws to protect their ability to continue to provide care in lieu of emergency medical treatment for EMTALA, which is, charity care, or also called uncompensated care, which is a federal law, a federal requirement that says anyone coming to the emergency department will be stabilized or triaged, regardless of insurance or ability to pay. However, as we have seen by many of those who have endeavored to oppose con laws, there's typically 1 or 2 hospital systems that work to maintain their monopoly by blocking more supply side options, such as ambulatory surgery centers, which are known to reduce cost and provide greater access to outpatient treatments. And by blocking those, they're really just limiting access to care. And further, and also to continue the ongoing references to the state of Georgia, I reached out to former ALEC HHS Task Force Chairman, who many of you in this room are friendly with, Judson Hill, who worked to roll back con laws in the state of Georgia during his time in the Georgia State Senate. And he had some advice for those who are looking to repeal or lead an effort to repeal con laws in your state. The first piece of advice he offers is to get your governor to either lead the effort or be heavily involved in the effort in this campaign. Without that, it will be very difficult to really fight the hospital lobby and the other interest groups that are going to come out and oppose the effort. One of the reasons is because just members of the General Assembly are not going to be strong enough or be a formidable enough force to see this effort through to completion. Another piece to that is the governor can bring the hospital groups to the table, negotiate with them, and potentially bring a bill with his help through the legislature, and he will ultimately sign that into law. So it's something to keep in mind if you are looking to lead an effort such as this. Another piece to consider is to look at states that do not have the limitations of con laws and see how their nonprofit hospitals stay solvent, financially solvent. So you can look to those examples and provide those when you come up against them in the media or with the lobbying and special interest groups that you're going to inevitably come before. And finally, the Health and Human Services Task Force at ALEC holds pretty true and has a record of holding pretty true to our principles of limited government, free markets, and federalism. And we, in 2009, passed a resolution opposing con laws. There's still more work to be done in this area, so I would love to talk to anybody about maybe presenting some other sort of model policy language that might help different states in this fight. But I have a copy of the resolution here if anybody is interested in seeing it. And with that, I would like to take any questions.
That was great. Thanks, Mia, for being here and for sharing that with us. You know, this is going to be very important, and we're going to hear from state legislators in just a second. But I think that that's the coalition that we really need to begin with: the state legislators and interested parties in the state, policy people, doctors, et cetera. And Mia knows the nuances of getting the model legislation out there, and so I think that she would be a great resource.